The other one is something that's quite niche. So I work with an upper limb surgeon called Sam Gidwani, and he specializes in hand and wrist operations. But he gets a lot of patients who have cerebral palsy or muscle spasticity, and they come with quite significant sort of posturing of their upper limbs.
Right.
And they're looking for things to increase, or they're looking for ways to increase function of that upper limb. So what we started doing, which is really exciting, is doing isolated peripheral nerve blocks with lidocaine. So we might do median nerve first and wait to see what effect it had on those muscles. And then based upon that effect, he would perform an ultrasound guided, so I'd hold the ultrasound, he does an ultrasound guided Botox injection of the relevant muscles, and then follows those patients up over time to see what impact the Botox had to decide whether they have muscle lengthening surgery. So we've done that, and that's really, really interesting.
Yes, I've heard of this. In fact, I think you're familiar with this too, but I have spoken to some people that are doing cryoneurolysis of those nerves, and the stories are almost too good to be true. Like, I haven't seen it firsthand, but reliable friends of mine that have said, I watched the rehab doctor do cryoneurolysis of the musculocutaneous nerve, and now this patient who's had spasticity for months or years can at least extend their elbow to a point where they can be positioned a bit better or not have complications from that spasticity. So that seems amazing.
It does. In fact, you know what? I'm going to give a shout out to him. There's a guy called Paul Winston who's from BC, Victoria in Canada. He has got some really almost unbelievable videos on Twitter or X where you see exactly this.
Yeah, Paul's the guy I'm thinking of, actually. So